Hayalperestlerin, risk alanların, denemekten korkmayanların cesaretinden doğduk. Bizi asla yarı yolda bırakmayan o sesin rehberliğiyle ilerlemeye ve öğrenmeye devam ediyoruz. Bunun için varız. Bu yüzden gece geç saatlere kadar lambalarımız sönmez. Elveda demek hem hüzün hem de gurur verir. Her şeyi sorgulayarak ve merakımızı besleyerek, dayanıklılığımızı test ederek, sınırlarımızı aşarak, ilerleyerek ve yeni ufuklar açarak yeni bir yol buluruz. Yeni icatlar çıkararak, kendi yolumuzu çizerek. Burası fikirlerin doğduğu ve yeni fikirleri doğurduğu, bizim de doğduğumuz, birlikte büyüdüğümüz ve yükseldiğimiz yer. Burası Yakın Doğu Üniversitesi.
Welcome everybody. Thank you so much for coming to our this event. So this week we would like to talk about breast cancer because of this Breast Cancer Awareness Week. We would like to talk about breast cancer. We would like to show some application for the breast cancer imaging using artificial intelligence and decision science. Here I am the coordinator, and Dr. Lina David from Medical Diagnostic Imaging, University of Sharjah, will show some phantom and how to do the diagnosis for the early cases. So I would like to start with my presentation first, since Dr. Lina having some technical issues, and after that Dr. Lina will present her own presentation. Let me start with mine. Okay, today we will talk about decision analysis of breast cancer imaging device. This work has done with one of my master student. Now he is doing PhD, Hasan Erdalı. So we have collaborated here with Harvard Medical School, Mass General Hospital, and Near East University. So this is the outline of my talk. I will give some introduction, and we will talk about breast cancer imaging devices. We will talk about decision-making theory, determining the most desirable imaging device for the breast cancer, and finally we will conclude. So breast cancer is the malignant tumor that starts in the cells of the breast and is the most common leading cause of cancer death in females. So if you will find the breast cancer at an early stage, you don't only can survive, the woman can not only survive, but also she will receive the less aggressive treatment. That is why it's very important to dedicate before the cancer is spreading through the body. So there are different kinds of breast cancer imaging devices. We have collected all in the board. So there is screen film mammography, digital breast tomosynthesis, ultrasound, MRA, PET CT, PET MRA, breast computed tomography, positron emission mammography. There is gamma cameras, and there is SPECT, and etc. So here what we have done is there are different kind of diagnostic tools. There are 11 different kind of diagnostic tools, but imagine that there are, in order to choose one, there are more than like 30 different criteria that you could think on. Criteria means that what the matters of when you choose the diagnostics. For instance, cost of per scan, that is matter. Cost for device, that's matter. Radiation dose is important. Specificity, very important. Sensitivity, scan time, spatial resolution. Is it the 3D imaging or 2D imaging? That is important. Compression, claustrophobia. So you need to take into account all of the criteria when you are picking which diagnostic tool is relevant for the breast cancer imaging. So if we go through one by one. So for instance, for the cost for the scan is different for the patient and hospitals. So cost for the device, it's very important for the hospital, actually, if you would like to buy one as an owner of the hospital. So radiation dose is the applied radiation dose units in medical imaging. That is usually we use millisievert. That is important parameters, because you could, if you give more radiation to the patient, that you could cause some other cancer issues to the body. So we need to be careful about that. Specificity, it's also very important parameters. That is true negative rate of the cancer. So it will give you the rate that whether this tumor is cancer or not. So that parameter, it's important that you could diagnose in a truth way, we could say. Sensitivity is also positive rate of the cancer. Total scan time, it is important. It is time for each patient who is spending for the breast cancer imaging operation. Spatial resolution is to distinguish between 2 point sources, between 2 tumors, we could say. That is very important as well. So is it 3D or 2D, for instance? If you are having two-dimensional imaging, probably you could miss some tumor inside. You could miss you could face some problems in the diagnostic tool. Whether while you have three-dimensional imaging, you could highly probably have better images, so you could detect the tumor. Compression, it's important because compression usually is aggressive. So women, they don't want to compress their breast because it's a bit painful. So it's not comfortable. But once you compress the breast, then you can there is high probability that you could see all the tumors, like also there is no movement betterly. So you could take into account all these kind of parameters. So claustrophobia is also a matter. For instance, if you tell your patient that you go to PET or MR for imaging, but imagine that the patient are facing the claustrophobia. So she cannot, because she has this scary feelings that she cannot stay in there. She thinks that she will die in there. Then she will move. So once she moves, then you will have bad images. That is also problematic. So there are some people that you need to take into account the claustrophobia as well. So let me go back. So the more the criteria that you are evaluating in the system for decision, the better result you will get. So how we were evaluating all of those criteria? So we use specific tools. We use all this data, relevant data, talking with doctors, checking from literature. Here you can see that the first I showed all of these diagnostic tools. On the top, you could see that all of these tools, and on the another side that you could see all of these criteria that you need to take into account. So imagine that as a doctor, so you have more or less 10 to 20 matrices. So at the same time, you need to evaluate. You need to calculate, and you need to do your decision. That is why it's complex problem, actually, because 10 to 20 matrices is not easy problem to solve mathematically even. Here we are using AI, we are using decision-making tools, we are doing decision-making analysis in order to see which is the ranking, the alternative, it's the best option for breast cancer patients, actually. So what we are using preference ranking organization method for enrichment evaluation, Promethean, and then we are combining this Promethean with fuzzy, that I will explain you in 1 minute about the fuzzy. So Promethean is the multi-criteria decision-making technique based on mutual comparison of each alternative pair with regard to of each the selected criteria. It is user-friendly, it is practical, it is successfully implemented in the real-life planning problems, and it requires two different information, that the criteria and alternatives, then you could weight the criteria according the desire of the experts. So here we are using special functioning in order to be comprehensive to finalize all the resulting. So we are using fuzzy, as I said. Fuzzy is like something not certain. When the data is not certain, that it's not numerical, there you can use fuzzy in order to convert this scale in order to calculate numerically. That is hybrid methodology. And here I would like to say the decision making with the multi-criteria decision making application of healthcare, it's done like 6 years ago in our group, like in the world. That was the first thing that we were studying in the world. And then from that on, so we have produced a lot of different kind of project, and we are very welcoming for the collaborators if you are interested to work this kind of studies. So we use linguistic fuzzy scale. There is 5 scale. You could also use 9 scale as well. So for the 5 scales, there is very low, medium, high, very high the data, and we turn it into numerical using some linguistic scale, as I have explained here. Then what we do is to weight the parameters according to desire of user. This user could be patient or hospital. So we have done 2 different analyses here. We use for patients. So the patients, for instance, that if we think about the spatial resolution is very important for patients. Specificity is very important. Sensitivity, the 3-dimensional image is very important. But cost for scan is important, but not as much important as spatial resolution, for instance. So compression is important, like medium important. Compression of natural air radiation exposure, it's low important. So here we have collected data according to literature review, and we have talked to experts. So we have done the similar data collection for the hospitals. For instance, so cost of device is matter for hospital. That is, we collected like an important parameters. For cost for scan, it's very important for the hospitals. Specificity, sensitivity, spatial resolution still important because you give the right diagnosis to the patient. So we have changed all the criteria according to the user's desires. And then finally, we get the results. So it looks like positron emission mammography is the best option for breast cancer diagnostic, while there is CT, that is computed tomography, it's second one, and then it goes the latest one, PET-CT and SPECT for the patients. And here you can see that for the hospital, PEM still is the best option. And then CT is the second one, while MRA is third option. You could see that the latest one is PET MRA and BSGI. So in principle, let me comment out about this figure. So this figure tells you that the first best option is PEM, and second one is BCT, third one MRA, and it goes like this. So this is ranking basically. So there is positive out ranking. The system calculates all the positive well-being criteria. It compares each other and gives you the general positive out ranking. And then let me share the screen. Share screen. Okay. Do you see my, I don't know, just give me 1 second. Okay. So in this slide, that it tells us that the best option is PEM, while the BSGI the latest one. So in principle, that while we are collecting the all positive outranking results, and its system gives you all the negative outranking results, like system calculates for each parameters, and then it gives you all the bad effects, for instance. It could be predictability, complexity, cost, and everything. So it calculates, and then it calculates general options for all of the rest of the alternatives, and it gives you this result. And once we are having positive outranking minus negative outranking, this gives us the net flow. So now the net flow gives us the best option, the first and the second one is this. But let me comment this one like scientifically. Actually makes sense because positron emission mammography is a small dedicated organ device that it's very practical, small, easy to shift, and then spatial resolution result is excellent for PEM. Energy resolution also because it's small, depending the crystal that are using. So that is the reason that actually it gives the best option for hospital and for the patient. And actually it is confirmed by the expert as well. The system is giving relevant and good options. So here is the plot that you could see that in the middle we have 0, that neutral you could consider, and below there is minus, and on the top you have +1. So in the minus part, that you could see all the bad criteria that are coming from different alternatives. For instance, for PEM, there is no compression, cost per scan is bad effect, compression for radiation dose. For instance, for PEM, they are using FDG, it's lots of radiation you give the patient. That is why it's bad effect. And then on the top, you could see specificity is good, sensitivity is very good, total scan time is good, resolution 3D, claustrophobic. So it's all good. That is the reason that is the best alternative while you compare with the others. And then this is the one of the PEM that I have put it so you could see the device, how practical, how small, how easy to shift. So here you can see the detectors. You compress it, and then in the conference now, and then yes, and then you compress the breath, and then you can scan the patient, and you could see the resolution perfectly. So this is the SPECT, that gamma cameras, and this is the BSGA. This is gamma camera also. You could see that. So in principle, we have done all the simulation for each criteria, which is the good parameters and which is the bad parameters, and we have evaluated it. So the second study that I would like to share very shortly, it's about, again, breast cancer screening based on supervised learning and multi-criteria decision making. This study are done, one of my postdoc, Mustafa Tapiva, is working in Operational Research Center in Near East University now, and I would like to share the results. So what we have used AI. Let me talk about basic learning system. So if you need to use AI systems, so you need to teach the machine the basic actually. So you need to give some input, and you teach the machine, and you have some output. Let's think about very basic. Let's give some apple and orange and banana to the machine, and you give this all the input parameters to the machine, and finally you have the output as an apple, banana, or orange. So now consider very complex problem. So for the very complex problem, actually we are using neural network. So you give more inputs, you give more complex inputs in order to feed the machine, and quite a lot amount of the data actually. And finally, you are using basic coding and mathematical calculation, and finally you get some output. In this study, so imagine that you are teaching the machine that who is woman, who is man here, male and or female. Here you can see that it's easy to show this information about the conference now online. So it's easy to show this kind of input to the computer, because you see that the woman having some long hair, the eye shape completely different. The male has eyebrow shape. He has short haircut, so she has bird, and you see like all different. So it's very easy to show this input to the to teach the input to the machine and have some result that is male or female. So the computer will tell you easily. But the problem with this, for instance, once you have so similar images, imagine, is it male or female for the computer? So it's very difficult to distinguish. The haircut is the same. There is no bird. There is no different eye shape. So it's very complicated. Here you use more deep learning, like more complicated tools in order to have good results, actually. So here what we do is to pixelize, for instance, each picture individually, or use a lot of amount of the money, the data, in order to get the finally to teach the computer that which is the relevant information, and then finally you get the results. Here in this study, what we have done, we have used breast cancer images, and we have collected these images from the open sources, platforms, which is for free, provided by some special platforms that you need to cite them, of course. That is what we have used. Two different data sets we use. So in that data set, you have benign sample, malignant sample. We teach the computer, and then we use, we have predicted which is the positive or negative. Is it true positive, false negative, false positive, true negative? So we have teach all this information to the computer, and then finally, so we use 5 different artificial intelligence tools, and then so we calculate all of them, their accuracy, precision, the time, all of this relevant information coming from the machine learning. And then what we have done, actually, this data set is coming from Wisconsin, actually. So what we have done is to use multi-criteria decision analysis in order to check which machine learning algorithm is the best option for breast cancer diagnostic. So here you can see the first option is SVM, the second one is KNN, third one logistic regression, and the fifth one the random forest. So what we have done is to use different brands data sets. There's a second data set collection. We have done the same, actually. We use 5 different machine learning algorithms. We collect all the criteria, all of the parameters, results, and then finally we combine this in order to see that which is the best option for machine learning. So here you can see that the results, SVM still the best one, while KNN is second one. So here you can see that which machine learning algorithm is best one for the breast cancer diagnostic. So now here you can see the plot. So in the center, there is, you could think that is neutral, and in the below there is -1, on the top there is +1. In the -1, here you can see all the negative criteria, and on the top you could see all the positive criteria in order to combine which is the best option, actually. And this is for other data set. We have used 2 data set. And if we conclude, so this is actually a novel approach, and it's published, this study, recently. So it gives us to determine the best AI techniques in order to breast cancer, in order to show for the breast cancer screening. And this consider is really important criteria, such as the number of sampling, the impact of the feature scaling, tuning, and all this relevant information coming from machine learning. So in this study shows us the criteria are really matter, and we could apply this one using some application to the hospital. Actually, it would be very useful, fast and efficient and cheap actually. So this is our future plan in order to proceed professionally in the hospital. Okay, this is our team. I would like to thank them. They are working in operational research center in Near East University. So they are very dedicated and they are very positive for the collaboration. You are very welcome if you would like to collaborate. Thank you so much for listening to me. Okay, I would like to ask Dr. Lina is here. Dr. Lina, can you open your microphone, please, Dr. Lina? I don't hear you, Dr. Lina. I don't hear you. Let me introduce Dr. Lina first. Dr. Lina is from University of Sharjah, Medical Diagnostic Imaging Department. We cannot really hear you, Dr. Lina. There is no voice. So hopefully she will show us. She's expert on imaging. She's clinician, actually. Her expertise is breast imaging mostly. She would like to show us some phantom and how to see how to do the early stage detection yourself. It's very interesting. Dr. Lina, you hear us? There is no sound. We don't hear you. Please, we don't hear you. We'll give her some minutes, maybe they will fix the problem, technical issues. So, Dr. Lina, I don't hear you. There is no voice. There is no voice. Dr. Lina, we don't hear you.
Hayalperestlerin, risk alanların, denemekten korkmayanların cesaretinden doğduk. Bizi asla yarı yolda bırakmayan o sesin rehberliğiyle ilerlemeye ve öğrenmeye devam ediyoruz. Bunun için varız. Bu yüzden gece geç saatlere kadar lambalarımız sönmez. Elveda demek hem hüzün hem de gurur verir. Her şeyi sorgulayarak ve merakımızı besleyerek, dayanıklılığımızı test ederek, sınırlarımızı aşarak, ilerleyerek ve yeni ufuklar açarak yeni bir yol buluruz. Yeni icatlar çıkararak, kendi yolumuzu çizerek. Burası fikirlerin doğduğu ve yeni fikirleri doğurduğu, bizim de doğduğumuz, birlikte büyüdüğümüz ve yükseldiğimiz yer. Burası Yakın Doğu Üniversitesi.
Dr. Lina, can you hear me now?
I can hear you. Can you hear me?
Yes, we hear you. Yes, we hear you now. We hear you. Can you please? Yes, we hear you. Can you please share your screen so you can start? Yeah, you can just go ahead. Thank you so much for your effort.
Right?
Yes, we see you. We see your
screen as
your
well.
Screen. Yes.
All right. Okay. So thank you, Dr. Dilbar, for this opportunity. And good morning. My name is Dr. Lina, and I'm sorry for this technical things happened. So before going for that talk, hope you know about what you mean by breast cancer. Yeah. So Dr. Dilbar have given a wonderful talk about the research aspect. So I'll be talking now about how we can detect personally the breast cancer. So by the end of this session, I'm expecting that you will understand more in detail about breast cancer. What is the prevalence of breast cancer in North Cyprus? And what are the common risk factors? What are the early detection methods? What are the chances to prevent breast cancer? What are the treatment options available? And our role as an informed individual residing in the North Cyprus. So, cancer, as you may know, that when the cells start to grow out of control, we call it as cancer. Usually, in our body, the cells grow, then it will die, then it will recover, and so on. But in cancer, it start to grow out of control. So, if you look to the literature and by the data by World Health Organization, they say that nearly 10 million deaths in 2020 happened due to cancer. It's not only because of breast cancer, overall. We can conclude that 1 in 6 deaths happened due to cancer. Okay. So in 2020, 2.3 million women diagnosed with breast cancer. The previous data that I said is about whole cancer. Now 2.3 million women diagnosed with breast cancer globally. And in men, it is 1 in 833 because when I talk about the anatomy, you will understand why men are detecting breast cancer in a low range. So I was checking for some data for North Cyprus. So Globocan, they also conveyed that among the females, breast cancer is the most common one, and among men, it is prostate. So here also you can see breast cancer among the women is the highest. This is another study from done incidence of cancer in the Turkish Republic of Northern Cyprus. That study also conveyed that the breast cancer is more than the thyroid, than the skin among the females. And here another one study from North Cyprus. They are saying that uh, the age of incidence, average age of incidence of breast cancer is lower than any other countries. That means the age, usually when age increases, the breast cancer incidence also increase. But here the incidence of age is lower in North Cyprus. So they recommended that continuous monitoring of epidemiology is necessary, as well as further research is needed for identifying the reasons as well as for early detection. So now let me go to the risk factors of breast cancer. Gender. So why I said gender? Because being female is one of the major reasons for breast cancer. Because female, we have mammary glands. I will show that in an image. Mammary glands. So that causes more problem. And age, when age increases, the incidence of breast cancer also increase. Then personal history. What do you mean by that? So if a individual got a cancer in their skin, there is probability of getting to breast also, or in ovaries, probability of having it in breast also. So that's what personal history. Then family history. Family history is about their hereditary, mother, sister, daughter. If they have first 2 degree, I mean, having 2 first degree relatives, say for example, if my mom and my cousin sister, my first degree cousin sister, got breast cancer, then my chances is fivefold. If one family member have history of cancer, it doesn't mean that it should be breast cancer, any other cancer, then the risk is high. Genetic mutations, BRCA1 and BRCA2, this is breast cancer genes, but these are protective genes. It usually suppress the tumor cells. With the name, we think that it is, cancerous genes. No, they suppress the tumor cells. However, if any alteration happen in these genes, then it can lead to cancer. Then hormonal factors, early menarche, like first periods before 11 years, there is a high probability of them having breast cancer. Then late menopause, usually after 40 years, at the late 40 years, menopause can happen. But still after 50 years, if it is not stopped, then there is probability. Again, I'm saying that don't get worried or um, think that, oh, definitely that person will get the cancer. No, don't think like that. But I just want to say that there is high probability of them having getting cancer. Then postmenopausal hormone therapy. Like menopausal time, people used to have some hormonal imbalance. So people used to take uh, estrogen and progesterone, but this can alter as well as this can uh, also lead to breast cancer. Nulliparity, meaning not having child, because first child after 35 years, as well as nulliparity, because during this time, during pregnancy, the breast cells have undergo some changes, so that changes are required. So nulliparity and first child after 35 years is also considered as a risk factor. Then ionizing radiation. If someone would have undergone, chest CT or higher end radiation exposure for some other reason, then there is a probability of having the cancer. Alcohol, obesity, high fat diet. Some studies are saying that that can also be a reason for breast cancer. However, it's not 100% proven that it will cause breast cancer. Now, in the previous slide, I said gender. So let me go a little bit about the anatomy of breast, a normal breast. So you know that it is located on the anterior thoracic wall and it is conical in shape. You can see here. I hope you can see my mouse. You can see here. And extends from sternum margin to the mid-axillary line. This is our sternum margin till the mid-axillary line at the level of fourth rib. And it vertically extends from second to sixth rib. So there are three hormones that affect its growth, shape, and function: estrogen, progesterone, and prolactin. These are the three hormones that helps to maintain the shape, the growth of the breast, and basically this gland is designed to produce milk. So that production unit is called as the mammary glands. So if I go to the next slide, you can see here, these are the mammary glands. Okay. And in each gland, there are lobes. And it's like a bunch of grapes. So each grape, we can say that it is lobule. And that whole bunch, we can call it as a lobe. There the milk will be produced. From there, the milk will be come out through the ducts. So this anatomy is really important to know, such that when I explain about the types of cancer, you can quickly understand what exactly it means. And then we have some lymph nodes. Okay, these lymph nodes support us, or that is the main part in our body or even in our breast that functions for immunity. It acts like a filter, like our tea filter. So if we are pouring some tea powder in it, it will hold in the filter. So similarly, if there is any infection or if any pathogen comes, this will act like the filter. This nodes, lymph nodes, yeah, this will function on the immunity of a human body. This is also important to know here. And in a breast, we can see around 15 to 20 lobes. So you know what do you mean by lobe? Lobules, ducts, and the lymph nodes. So where all these lymph nodes are located, this is really important to know where all it is located, because when we do self-breast examination, these areas also needs to be considered. So lymph nodes near the collarbone, you can see here, it near the collarbone, and then we have it the armpit and near to the breastbone. So let me talk about types of breast cancer. Ductal cancer. With the anatomy now you would have understood what do you mean by ductal cancer. The cancer that occurs in the inner lining of milk duct. That is called as ductal cancer. And lobular cancer is in the lobes. Again, now you know where the lobe is, that mammary lobe. If you look to the ductal cancer and lobular cancer, see 90% of cancer occurs in the ducts because maybe the size, yeah. Then inflammatory breast cancer, that is the worst, I should say that, because we can't see outside. It block the lymphatic vessels. It may show like breast redness, and there will be no lump or tumor, and people will think that maybe some infection, so they will ignore going for undergoing treatment. So this can, like early detection, that early detection will be better. So in inflammatory breast cancer, people will diagnose once it reaches to higher stages. And if the breast cancer or the cancer cells migrate from one place and it will reach to the lymph system, and if it spread to other parts of body, then it forms secondary cancers. That is called as metastasis. Now, where we can find the breast cancer? If we divide our breast into 4 quadrants, I hope you can see me here in the screen, the phantom. If I divide this, just imagine this is the left breast. If I divide, I can divide it into 4 quadrants. This part is called as the upper inner quadrant, and this is the upper outer quadrant, and this area below the nipple, lower inner quadrant because it's towards the medial side, and this is the lower outer quadrant. And here this part is called as the tail of Spence. So what do you think where it can be commonly found? This is what the study shows. And this is another one study that showed that upper outer quadrant, that means this part, outer quadrant, near to the axilla. If you say near to the axilla. So this part got more chances because of the cells situated in, or cells in that area. Here if you look, see here also they said upper outer quadrant, then comes the upper inner quadrant, then comes the lower outer quadrant, again outer quadrant, then the lower inner quadrant. So when we do self breast examination, we should look to the outer quadrant, even the axilla, because I told about the lymph nodes. They're all areas we have to consider. But in short, if I say it can happen in any parts of the breast, it doesn't mean that it should be in the outer quadrant. It can happen in any parts of the breast. Clinical staging of breast cancer, I try to use a very simple format of explaining that one because there are higher end stages like TNM, tumor, node. There are many stages, but here, for easy to understand, I'm using this with the size and where all it extended. That's how I'm going to stage the breast cancer. So stage 1, tumor size is within 2 centimeters. So if you look here, it's within 2 centimeter. And stage 2, tumor size is 2 to 5 centimeter. It started growing. And 3, it's more than 5 centimeter and it reached to the lymph nodes. And stage 4, it compromised with the lymph nodes and it started going outside, like it could have reached to the brain, lungs, bones, liver, or anywhere in the body. So now with this image itself, you would have understood why we have to promote early detection of breast cancer. Survival rate of, when we compare to the survival rate with the stage, if you look to the stage 0, this is a 5-year survival rate I'm talking about. Stage 0, they say 100%. Stage 1, again 100%. Stage 2, reduced. Stage 3, further reduced. Stage 4, much reduced. And this is 1-year survival data. That is, again, you can see here, early the detection, survival rate also will be higher. So it depends on many factors. It doesn't mean that the early detection, maybe it depends on many factors of each individual, because the cancer cells are not same for everyone. So it depends on the whether it is localized, whether it's only in one region, or whether it's in distant area. Those all factors, as well as the metabolic factors of an individual, can also affect. However, early detection is longer survival. Then now let me tell you about what are the early detection methods that is available. Breast self-examination. It is easy, no payment, only we have to have our own time. Then clinical breast examination and screening mammogram. Let me just finish first with the clinical breast examination, because it's done by a healthcare professional. When you have to do after 20 years, we have to do a clinical breast examination. Once in every 1 to 3 years, we have to do a clinical breast examination. Now, breast self-examination. By the way, this is done by a trained healthcare professional. So they may do while you are standing, they palpate the breast, they look to the armpit, they palpate the armpit, and then they ask you to lie down and they will check the breast. That is how they do the clinical breast examination. Now, breast self-examination, it is a visual and physical inspection of our own breast. When we should start? From the age of 20 years onwards. And we should do it in once in a month on the same day. Say, for example, if I said for 14th of November, so December 14th I should do. And I should not check frequently, because we will not be able to appreciate the change that would have happened. And 1 week after period preferable, because there are changes that happens in the breast. So better 1 week after the period, and do not do often in the same month. So how to perform breast self-examination? First, we have to stand in front of the mirror. We have to remove the clothes, the upper part of our body. Then we have to check the breast visually. So when we check the breast visually, these are the common unusual appearance of the breast for breast cancer, like a thick mass. So here, like we can see a thick mass. When we palpate also, we can see thick mass. Or some part of the cells will go inside, or like skin erosion, like if we get some scratch, there will be some erosion of skin. So the same appearance can happen on the breast, or in one place there will be redness or heat can be felt, or unexpected fluid from the nipple, or dimpling. If you look here, I think it's being shown like this here, dimpling. Then bump, maybe some projection outside, or some veins will be projected out. Usually the veins are shown, but if any problem in the breast, that veins, those areas will be projected, it become more thin. Or the nipple can go inside, or there can be unusual shape between two breasts. Usually there will be unusual size or shape, but if it's suddenly changing, then there is some problem. Then orange peel skin, like our normal orange peel, in some part of our breast can have this appearance. Or a hidden lump inside. When we palpate, some, like we can feel it. There is some unusual growth. So don't get panic when you explain to someone, because now you know what all can be the appearance. So don't get, when you explain, don't think that, oh, if someone is having this, definitely they have cancer, or if some problem we are also facing, don't think that. We have to get second, or we have to go for test, because this can happen due to many reasons. It doesn't mean that it should be breast cancer. So first we did the visual inspection, so we recognize that nothing is here like this. And step 2, we have to watch closely to the mirror, and we have to clasp our hand behind like this. we have to clasp our hand. Then we have to press forward like this. And then we have to check the contour of the breast. If some muscle tightness is feeling, that means there is some pathology. That doesn't mean that it's definitely the cancer, but there is some pathology. The second thing, again, we stand in front of the mirror. Then we have to press the hands firmly on both the hips. Okay. Then we will bow down toward the mirror, and we have to pull our shoulder also forwards, elbows and shoulder forwards. At that time also, if we feel some tightness, that means there is some changes happening in the breast. Now, step 4, we have to squeeze the nipple to see whether some discharge is coming. But usually it is common immediately after feeding. I mean, feeding meaning 1 to 2 years, there can some, discharge can come out. But we should ensure that it's not blood stained or unusual discharge is not there. And the fifth step, we have to, it's better to do under the shower, because at that time there will be some, there will be no much grip. So we can palpate the breast easily. That's why. So we have to use 3 or 4 fingers of our right hand to feel the left breast. And we have to raise the hand, and what we should do is we have to palpate. See, if you're using these 3 fingers, we have to palpate like this. So if I'm using this circular motion, I have to cover this one, even my underarms, my axilla also, and the locations there where I showed the location of lymph nodes. So I will palpate like this. And if I'm using this way, next month also better to do this. Or one time you can use 2 ways, like either circular or from side to side or up and down. Which one? Varying pressure we should use. First we have to palpate very calmly. Then we have to press little more down in all the areas. Then further more compression should be given while we are palpating. The same thing we do while lying down, because it will help to spread the breast tissues, and we can palpate quickly. So we have to keep a pillow or some towel such that the breast will get spread. So to summarize, to say how to do self-breast examination, first we are standing. I hope you can recollect now with these images. Okay, now comes the importance of screening mammogram. Medical imaging plays a major role in the diagnosis of breast cancer. Usually for mammogram, they take 2 views, that is craniocaudal, meaning craniocaudal, like this, they will compress the breast, and mediolateral oblique, from medial side to the lateral side, they will compress the breast. And the study showed that even less than 1 centimeter of pathology can be, less than 1 centimeter can be detected. Do you remember the stages that I said? 2 centimeter, 1. So here, even less than that, we can find. That means mammogram can detect cancer before any symptoms or changes that we can notice in the breast. So this is how they show the breast lesion. If some pathology is there, they will show that at this location. This is how they report the clock position. If some pathology is there at 1 o'clock, they say that at 1 o'clock, position of the right breast, so and so, like that. And they usually we ask to do the screening mammogram after the age of 40. Why? Because of the cell structure. Before 40 years, it will be more hard, and the fat will be, nodular property of the breast will be there. So we can't see the lesion properly. But after 40 years, the structure of the cell varies, and we can see the pathology clearly. And this is how they report. They say that if it's BI-RADS 0, then it is incomplete. BI-RADS 1, it is negative. BI-RADS 2, benign findings. BI-RADS 3, probably benign. BI-RADS 4, suspicious abnormality, then they recommend for biopsy. BI-RADS 5, highly suggestive of malignancy. And 6, it is biopsy prone. So when you see someone's report, you can see like this. And with one modality, usually they don't confirm that it is breast cancer. Multiple modalities they use, ultrasound they use, MRI they use, as well as fine needle aspiration cytology, that's the biopsy. So without confirmation, if we see some changes suddenly, we should not think that that is breast cancer. These are some of the treatment options like surgery. Nowadays, there are olden days they remove the breast. Okay, so nowadays they kind of keyhole surgery they can do, but it depends on at what stage it is get diagnosed. If it is an advanced, definitely we cannot um, save the breast. So that's why again early detection is really important in treatment options. They do chemotherapy, radiotherapy, hormone therapy, lymph node dissection. Then they can apply therapy directly to the cancer cells also. Now, what are the chances to prevent breast cancer? Definitely, for all disease, we have to maintain healthy weight, adequate sleep. I think that we as professionals, we have to think adequate sleep. That is really important. Daily exercise and stress management techniques, reduce the intake of excess fat, if possible. If the benefits is outweighing the risk, fine to go ahead with the hormone treatments. Otherwise, don't avoid, better to avoid any hormones. Then avoid birth control pills. Again, if the benefit is going to outweigh the risk, yes, go ahead. Otherwise, we have to avoid birth control pills. Then if we know someone in our family, it's even if it's not first degree, second degree, someone having the cancer in the family, then we have to be more cautious or be alert to examine our breast. And of course we should consider breastfeeding, because like the cell structure, the cell not structure, the cell duplication, many changes in the breast will happen doing breastfeeding. Some misconceptions are there. Before winding up, let me talk about these misconceptions. People will think that only older women will get. No, at any age. It can. I showed some studies from North Cyprus also. So, any age it can happen. And if you have a risk factor for breast cancer, you are more likely to die. If I'm thinking that, oh, my mom have, so definitely I'm going to get it, that's also a misconception. Then, oh, if I don't have a family history, so I'm safe, that's also a misconception. Then, oh, only if my mother's side is having the breast cancer, then my risk is high, that is also misconception. Anyone, father, mother, anyone. Then use of birth control pills, again, it's debatable because hormone changes. So again, benefit outweighs, then go ahead. Monthly breast self examination definitely will show the breast cancer. No, it can, but mammogram or clinical breast examination and further checkups are required after 40 years especially. Then if I know that my family members are having, definitely I am going to get it, so nothing I can do about it. Don't, we should not think like that, because early detection is really important. Even family history is there, whatever, maybe early detection can increase the survival rate. And when you give awareness to someone, maybe you will be sharing with someone else also about this. So don't think that breast cancer is a death sentence. Nowadays, our treatments are, many options are available. Now you should think about what is your role. Actually, I did a research here in UAE, um, and it's about to publish in Asian Pacific Journal of Cancer Prevention. They are saying individual, interpersonal, community, and organizational, as well as policy level. This is socio-ecological model. So we could find out what are the factors that is in the in each level. So we all, if I look, academic institutions plays a major role. Individual awareness, interpersonal, along with that, academic institutions plays a major role. And thank you so much for listening. And if any research or if anything related to breast cancer, we can collaborate along with Dr. Dilbar. And I have a story to share if you allow, like starfish throws.
Yes, Dr. Lina, go ahead, please.
All right. So I usually share this story when I give sessions because it was so motivating for me. The story is like that. One girl, a small girl, was standing on the beach and she was throwing something back to the sea. By that time, an old person was coming and asking, and he was curiously looking to the girl and asked, "What are you doing?" So she said, "I'm throwing the starfish to the sea." So the old man was wondering, what change are going to happen? There is miles, winds are again coming up, then thousands or millions of starfish are outside the sea, on the shore. Those all are going to die. Then what change are you going to make? So she smiled at that old man and she took another one starfish and threw it back to the sea and said, "I made change to that starfish." So I hope with our awareness as well as with our knowledge, we have to save. By God's grace, if I say, while I did my intervention for my study, the research that I showed earlier, 2 people could diagnose it early because they did mammogram, and they could diagnose early, as well as one could find out some cyst inside. So I think with our knowledge, with our all the talents that we have, as well as all the facilities that we have, we should share awareness because early detection saves lives, and we should never snooze it for ourselves as well as to our community. Thank you.
Thank you so much, Dr. Lina. It was excellent message for us. Also, the excellent presentation and all this facilities that you provide us. Thank you so much again. I would like to close the session if there will be no question. Let me check my chat if there will be questions so I can see. So Dr. Betül, thanks for the nice presentation. Thank you. We thank you all, Dr. Berna, Tatenda, yes. Okay, I don't see any question. I guess we are done. Thank you so much again, Dr. Lina, and thank you all the attendants in order to make this session possible, and the nearest university. Thank you so much.
Thank you all. Thank you, Dr. Dilbar, and everyone who arranged this. Thank you so much.
Thank you. Thank you.
Hayalperestlerin, risk alanların, denemekten korkmayanların cesaretinden doğduk. Bizi asla yarı yolda bırakmayan o sesin rehberliğiyle ilerlemeye ve öğrenmeye devam ediyoruz. Bunun için varız. Bu yüzden gece geç saatlere kadar lambalarımız sönmez. Elveda demek hem hüzün hem de gurur verir. Her şeyi sorgulayarak ve merakımızı besleyerek, dayanıklılığımızı test ederek, sınırlarımızı aşarak, ilerleyerek ve yeni ufuklar açarak yeni bir yol buluruz. Yeni icatlar çıkararak, kendi yolumuzu çizerek. Burası fikirlerin doğduğu ve yeni fikirleri doğurduğu, bizim de doğduğumuz, birlikte büyüdüğümüz ve yükseldiğimiz yer. Burası Yakın Doğu Üniversitesi.